Good evening, everybody. We'll just give a moment to let everyone make their way in here. Hi, Dr. Allen. How are you tonight?
Hey, thank you. I'm doing fantastic. How about yourself?
I'm good. I'm excited to have you here. I know we have a lot of people who are signed up. So, without further ado, let's get started because I know you have a lot of great information to cover. So, welcome to tonight's Wu University event, How to Talk to Your Patient with Ocular Surface and Lid Disease with Dr. Joseph Allen. I'm your host, Dr. Jennifer Stewart. So let me introduce, it is my great pleasure to introduce Dr. Joseph Allen. He graduated magna cum laude and salutatorian from the Rosenberg School of Optometry in 2015 and completed his residency at the Minneapolis VA Medical Center. He's a fellow of the American Academy of Optometry and a diplomate of the American Board of Optometry. He's a member of the American Optometric Association, the AOA Strategic Communications Committee, and he completed the AOA Leadership Training in 2022. He was also awarded the Media Advocacy Award from the AOA in 2021. He's a practicing optometrist in Minnesota and the founder of Dr. Eye Health, an educational YouTube channel with more than 900,000 subscribers. That's amazing. We have to get you to 1 million. So that's
Oh.
our goal tonight.
We actually broke 1 million just a few months ago, so it's a little bit
Oh,
more than that now.
congratulations. You have to
Thank
update your
you.
slide. So congratulations with over 1 million subscribers. There he provides information about eye health, ocular disease, and vision products. His videos cover a range of topics that his subscribers frequently ask about eye floaters, glaucoma, dry eye, contact lenses, eyeglasses, and more. Dr. Allen is the host of I Give a Damn, a podcast by Fluorescein Media, which focuses on speaking to optometrists about topics they give a damn about. Dr. Allen has been featured in Ask Men and Oprah Daily, and in his free time, he enjoys rock climbing, running, cooking, playing video games, hiking, and biking. Welcome, Dr. Allen.
Thank you so much. I know we have some financial disclosures that are on here, and thankfully, really what we're talking about tonight, there really is no financial relationships that to really have a problem with. Everything's been mitigated. But I do want to start off just saying thank you to Wu University, to everybody involved, also to everybody who's just being present and live right now. I always love these opportunities to be able to speak, especially to other optometrists. This is a huge part of my passion and what I do and being able to talk about these things. Tonight's education and topic is different. And you probably noticed that there's not many uh, other lectures or not many people talking about communication strategies and specifically around ocular surface disease. So that's going to be our major kind of topic that we'll be touching on. Again, if we have not met before, I do have the Dr. Eye Health YouTube channel. That's where most people probably know me, just for my social media presence. We did break over that 1 million subscriber mark, which is huge. I think is just a testament to how important and valuable our knowledge is as eye care providers and how much people want to know about this. In addition to that, if you haven't checked out, I do have the I Give a Damn podcast where you can learn a little bit more, just conversations with leaders and entrepreneurs and really just rock stars in our profession I've been able to have over the last year and a half. We also have the Eye Care Insider series over on itube.net. If you're not aware of that, that is YouTube style videos, but educating and talking to other eye doctors. And so if you want to learn about new medications, about new research that's coming out, new procedures, and just want to kind of learn more in that direction, then definitely check out itube.net and check out the Eye Care Insider series. So let's take a step back and ask, like, why are we talking about patient communication? This is kind of a different topic. Again, let us know. Let me know in the comment section, even right now in the Q&A or in the chat, if you've ever had a lecture in your, if you've ever had a lecture in like your, let's say, undergrad on communication. Have you ever had a like an actual heard other lectures, other doctors talking about communication in the clinic? This is just a different topic, right? But the reality is communication matters. How we talk to patients, how we present ourselves, all makes a difference. And remember that, what do they say about 80% of communication is nonverbal? So really important things to keep in mind. The real reason patient communication matters in eye care and in healthcare is because it affects how much your patient is going to trust you. It's going to affect how they respect you, really the relationship overall, and how that patient perceives you as a provider, but also your clinic. And this further gets kind of shed light onto how a patient will adopt a medication, a therapy, a procedure, how well they're going to take in these new really recommendations or prescriptions that you're going to be giving the patient. It's also going to affect their adherence to these therapies, right? If a patient doesn't fully either trust or respect or buy in to how important this condition is or how important this medication is to take twice a day, then they may just, they'll try it once, twice, and then forget about it. So adherence can be affected by your communication. Empowering a patient. This is a huge thing, and I think is the most difficult part of communication is how to empower a patient to make a lifestyle change. Think of our patients who are smokers, and we know that they're at risk of macular degeneration. If you can somehow communicate and empower a patient to not just know that, hey, this could be causing a blinding disease, but if you could empower them to make a lifestyle change that's going to have ripple effects on not only their life, but potentially other people's lives, like that is extremely powerful. And in addition to this, of course, having good communication will avoid medication errors. Again, think of like how many times I've written and prescribed cyclosporin medications just to have a patient a few months later come back in. They're like, oh yeah, I use it once a day, every once in a while when I feel I need it, right? And then we know that that's really probably just the carrier molecule and not necessarily the active ingredients. And so that can help avoid medication errors. And then improving dropout. If we have better communication, we can prevent our patients from just dropping out and not showing up. This is one publication from 2019, done out of Japan, specifically on dry eye disease patients and those who just lost to follow-up for ophthalmic follow-up. They did a survey of over 1,000 people. They asked, hey, how many of you have a diagnosis of dry eye disease that you're aware of? And it's only about 15%, so not a huge population. But of those people who had dry eye, 67.7% of them admitted they just stopped going to see their provider for dry eye. That's a lot. And to put that in perspective, patients with diabetes are reported around 11% are just lost to follow-up who don't show up. In psychiatric conditions, 53%. That's supposed to be the high end of the most likelihood of specialties for patients just to be lost to follow-up, right? Because if they have serious mental health conditions or even things like depression, anxiety, which we'll talk about, they may not be motivated. They may not be as ready to go in and keep seeing a provider. And dry eye breaks that 67.7% based on this one study. And this was a survey. They did break it down to one, the biggest factor is patients are just too busy to visit the physician. And I get that, right? It takes a whole day sometimes for patients to schedule an exam, come in to see you. They have to travel, they have to take a day off of work. There can be a lot involved in that. But looking further down on this list from this study, there's a lot of things that we can't control. Maybe long time wait in the clinic, maybe we control that a little bit. Symptoms don't change with the treatment or they're unsatisfied with the treatment. That's a hard thing. Sometimes we just have to figure out if it works or not. Out-of-pocket cost being too high, that one I actually think is more of a perception thing, right? Is it truly too high to pay for these different therapies or just to see the doctor? Or is it a perception of value? The cost is higher than the patient's perception of value for seeing that provider or for that procedure or therapy. And if we can communicate better, we can switch so our patients understand that value and they're more willing to come in and see us. And then finally, only 8% in this small study, but specifically said that insufficient explanations from their physician was the reason they didn't want to go back. So again, these are things that we can control. Perhaps the insufficient explanation, and then maybe ways we can communicate value of our evaluation, value of procedures and treatments. Huge topics. So in tonight's education, we're going to be breaking down how to improve patient experience and perception. We're going to talk about why ocular surface disease and lid disease is so challenging, like why that is such a big part of this. We're going to share some key communication concepts and practices, and then ultimately review some tips, tricks, and some key phrases that I hope that you can, if you're somebody who's just not, you're having a trouble formulating, how do I present this? How do I talk to a patient a little bit on this certain challenging treatment or condition? I'm going to share some of them that I hope maybe you can try out and get some success with. So the first part is improving patient experience and perception. Our goal is ultimately to improve your patient's perception and respect you better as a provider, to gain their trust, and then improve your relationship with your patients. To do this, this is kind of a fun idea that I came up with, and I would love for people to drop in the chat your red flags. If you've ever gone on a date with somebody, there are some red flags I'm sure you can think of that would just be like, that's a bad thing. I'm going to run the other direction. Because in eye care and healthcare, seeing patients, if you're seeing 15, 30, or if you're in like a retina clinic, you're seeing 60 patients a day, you're speed dating. It's very similar. And so let me know some of your red flags. I would love to hear that. One of the big kind of red flags to a patient's experience seeing you is being late or behind. And I think this is a tough one to hear about because a lot of times that's out of our control, or at least I feel it is, because we may have an emergency that comes in. You have a patient who comes in late and that throws you off, or even just the patient spends too much time digging in their bag trying to find their insurance card. That can set you behind as well. So this is a big thing, but you try your best. Not being present with a patient is also a huge thing. And I think this is a huge plague in our society in every regard, but we have so much of us sitting there flipping through phones. If somebody's on a date and they're flipping through their phone the whole time and they're not paying attention to you, they're not going to like you. They're not going to feel valued. And so how do our patients feel when we're sitting there flipping through a tablet or on an EMR on the computer and clicking a million things? We're not making eye contact, and they're probably not going to perceive that we're listening to them and really valuing them, their time as a person. So things to be aware of. Being rude, and not just rude to the patient, being rude to other people. So on a date, if your date was rude to the waitress or the hostess, that's going to come off pretty negative. So if you're being rude to a staff member and a patient overhears that, then they're going to kind of assume that you're also going to be talking about them that way, or you're going to be that you might address them that same direction. Poor communication in general. If you're not giving enough education, or if you're not giving the right type of communication to a patient, then and consistency. If your communication is really good in the exam room, but your communication between you and your staff members and nobody seems to be on the same page, that also breaks down trust and reliability and respect of your clinic, your brand. And then finally, smelling bad. And I kind of throw this in there to be funny, but it's true. I had a mentor when I was going through my final rotations as a student, and they said, hey, Joe, you can be the best doctor in the world, but if you smell bad, if your breath stinks after lunch, that's all the patient is going to remember. And I asked him about that because he was always using Banaka, the mouth spray. And it's pretty true. Remember, think of it, our olfactory senses are the shortest connection to the brain that connects to your amygdala and your thalamus, and that integrates into long-term memory. And so, again, just keep that in mind. Maybe brush your teeth after lunch, just in case you had a lot of onions or something. Let's set the stage. Again, this is just some simple tips about making sure your clinic comes across the right way. As a provider, this is what we see, right? We're used to seeing what our normal clinic day looks like. We can see the exam chair, everything looks just fine. But from the patient's perspective, when was the last time you sat in your own exam chair and looked around? How do things look? Are things dirty? Is there, like some dust on something? These are things that your patients are going to see while they're waiting for you, or even during the exam. If they pull up to the slit lamp and there's, an eyelash or a hair, or maybe as a student in school, remember looking into the light bulbs for the slit lamp, they can be kind of dirty and covered in dust. The point is that if you're not giving a good presentation, especially if it's a first new patient, remember you only get one chance to make a good first impression, then it's going to set the wrong vibe in how that patient's going to interpret your medical advice. So I think it's important to have clean rooms, make sure they're sanitized, having a professional or kind of a more medical looking setting. high tech versus low tech is totally up to you and depending on the audience you're trying to attract and the branding overall that you're trying to make. There's some clinics that are very high tech in the form of not only just optometry, but ocular surface disease and those sort of things. But there's also clinics that are very low tech and find great success. But it depends on how you want to present and how you want to show up to your audience and your brand. This is a general tip. If you're just not sure how to communicate, you've never heard of this book, this has been around since the 1930s. Dale Carnegie, this is kind of like a fundamental book if you ever get into sales and marketing, how to win friends and influence people. I don't recommend everything out of this book, but these are just the top 9, I think, that apply really well to just general conversation, especially in healthcare. One, being genuinely interested in other people. That's going to come off like you're not just looking at your patient because they're a patient and they're just like a check mark off your list that day. Be genuinely interested in who they are in your community, their family. If you have time to have those conversations, that's going to really come across to them authentically. Smile, be happy, shed smiles. Like it can be infectious to have a good smile and just be in a good mood throughout the day. Using your patient's first names. Again, people's names are kind of like, it means a lot to us. We like getting attention. And so learning the first name of your patient and trying to use it throughout the visit is going to show that you care about them, that you care about like their name, what they're called, and it's just going to give them a better overall experience. Being a good listener, of course, understanding and supportive, not criticizing, condemning, or complaining, especially about other people. Because again, if you're complaining about another person in front of your patient, then they may assume that when you leave, you're going to be complaining about them. Talking in terms of the other person's interest is huge, and we'll talk about that a little bit later here and how we talk about ocular surface disease. Beginning in a friendly way kind of goes back to smiling. And then another huge one is make the other person happy about what you suggest. It's very difficult, but extremely powerful, especially in a healthcare setting when you're trying to empower a patient to make changes about their life or take a medication or a procedure or their even their disease condition seriously. Another great book, if you want to read a little bit more, is a book called Motivational Interviewing. This is usually used in therapy, in counseling sessions, but it's also used in other forms of healthcare. Very, very powerful. And I'm sure a lot of us already feel that in our normal, just day-to-day patient interactions, it seems like almost 50 to 80% of what we do is therapy for patients sometimes. Like we're doing eye care, but part of it's just listening to our patients and providing that. And I think eye care providers probably do that, like optometrists probably do it better than a lot of other specialties and doctors because we have a little bit more time to spend with our patients. But the whole goal of motivational interviewing is to enhance intrinsic motivation. That means that you're not the doctor talking down to a patient, just do what I say because I'm telling you what to do. Instead, you're trying to communicate and talk with them so that your patient comes up with the result and the decision that they want to take this treatment, they want to make this change for their own values and reasons, and they make that decision. Not just because you told them to, but because they intrinsically came to that decision themselves. It's very difficult to do. It's not something that you'll just get overnight, but it's a practice. And I think this is a great book to start reading and start implementing into how you can communicate with patients. So let's talk about lid disease specifically, ocular surface disease and lid disease. Why is this such a challenge with communication? Why is it so important? First is because these conditions, especially dry eye, is chronic. We don't technically have a cure for dry eye just yet. It's something that we manage. A lot of times other conditions like blepharitis are often also recurrent, right? We may treat it one time with an antibiotic or maybe an antiparasitic now, but they often do come back. And so it's something that we need to be managing and discussing with our patients, and they can be really challenging. In addition to this, diagnosis and treatment can be challenging, especially for, I would say, ocular surface disease or dry eyes, because we have patients who have seen multiple providers before. They've had several diagnoses before. They've tried multiple medications and everything keeps failing. And so it's easy to like give up hope and lose that confidence in the provider, confidence in the profession, confidence in their treatments. And so that can be a challenging component. Mental health conditions is ripe when it comes to these two forms, dry eye and different forms of blepharitis. Both depression and anxiety are really high in these populations, and we'll talk about that a little bit more in a moment. And then they're very personal and intimate. And if you think about this, patients with severe chronic red eyes, if they're going out in social interactions, that can affect how people see their eyes. They can think that they may be maybe taking an illicit drug of some kind. They can think that, hey, that they've been crying, or maybe they've been abused and they're really emotional. Or if, again, there's just a lot of things going on in the eye. And then even more so, in the cases of something like Demodex blepharitis, for example, your eyelids being told that you have an infestation or an infection, this can come across very personal because our face is part of our identity. When we look into the mirror, that's who we are. And being told that you have a really nasty infection or something like a Demodex mite growing in your lashes and your hair follicles, that can kind of make people feel dirty. It can make people feel like they're unclean or something's wrong. And so this is just some pictures I've had of a patient who had pretty severe Demodex blepharitis. I don't think anybody would have a hard time diagnosing this one. But again, when you talk to these patients about these sort of things, it can affect them, and it's maybe a little bit challenging. So one thing that there's different ways to approach Demodex, and I'll just throw this in here now. Certainly, there's the very obvious, just be open, honest, and direct with a patient. And those are patients that I read as they're mature, that they have an understanding of they're a little bit more medically inclined. For example, I have one patient who she works and has a business where she grows microbes. She literally grows STDs and in petri dishes in a lab to sell to companies so that they can work on medications and testing. And so she, as a patient, if she ever had Demodex, it'd be very obvious, very, very easy just to be an adult and be like, hey, I just want to be open and honest. The reason your eyelids are burning, feeling irritated is because we have this kind of dust mite that lives on our skin, but it affects our eyelashes specifically. And there's some people who get it more than others. And as we get older, we're more prone to getting them too, because our oils in our skins change. And this is what we have. Thankfully, we have an FDA approved treatment for this. And so it's going to be pretty simple and easy. I want you to take this twice a day for 6 weeks. Boom. Do you have any questions? So that's somebody that's a little bit more direct. But if you have somebody who's really anxious, let's say you have like a 16-year-old girl in your chair, she's been doing false eyelashes and they're irritating her, and she comes in and you look and you see at least 10, 20 collarettes when she's looking down. Right there, you know what you're dealing with. I always love taking photos of my patients so I can show them what's going on. In that sort of case, you maybe want to be a little bit more cautious about how you're explaining to a patient, because you don't want to freak them out. You don't want to cause them any more distress, especially if they have a history of PTSD or anxiety in their history. You want to be cautious about how you approach those patients. And so for this sort of a scenario, I would probably not only take pictures of, but then I would explain to them, your eyelashes, I think they look beautiful. However, just from looking at you, nobody could tell that there's something wrong. But under this microscope that we have, I can see a whole different world going on your lid lashes. So let me show you this picture. You see all these little like yellow spots? So you know how people have dandruff on their scalp? You ever had that where people have dandruff? So sometimes there's microbes, little microorganisms, just like bacteria and everything that lives on our skin. They love to eat all these oils that are building up along the lashes. And again, no one can see this if they're just looking at you. But under this microscope, this is what we see. And those microbes, they release a lot of inflammatory things that cause your lids to swell, become red, and they itch. Thankfully, again, we have an easy treatment. It's FDA approved. We'll prescribe this for you, and it's going to take care of it. but it takes about 6 weeks. So we'll schedule you for an appointment in 8 weeks so we can just monitor and make sure that it's not progressing and that's taken care of. And then you can go on to having conversations about eyelash extensions and all those other things. But it really comes down to being able to understand and read your patient and just changing your language a little bit. Mental health, again, just to touch on this, depression, anxiety, very high in both these populations for both dry eye disease as well as blepharitis. And again, it kind of goes back again to having chronic conditions that's constantly irritating. I think of dry eyes having chronic pain disease. And then blepharitis, again, not only could be irritating, but then redness, irritation, flakiness, irritated skin, all of that also contributes to your personal self-image. Mental health concerns, these things, depression, anxiety specifically, they don't just come as a result of having these conditions. They also have bidirectionality, meaning that when you have anxiety and depression, they can make and cause dry eye disease to be worse. In addition to this, it'll trigger lifestyle changes, namely sleep and eating pattern changes. Think of it, if you've ever had depression or bad anxiety, it can keep you up at night. It can prevent you from sleeping very well. It can prevent you from eating regularly. And all of these things are known to affect these two conditions. It also can affect your adherence to medications, because if you're really depressed and you're having a tough day, it's even just a win if you get out of bed that day, then they're less likely to take those medications and they're more likely to be lost to follow-up. So just something to be aware of. It's also, I think, just important to make sure you're asking your patient if they have mental health resources, if they are struggling in any of those ways, if there's anybody that you could maybe help like maybe even refer to another professional for counseling or something like that. And then just being aware that medications that are often taken for depression and anxiety also affect our tear film, like SSRIs are known to disrupt the aqueous and mucus secretions. Okay, so we've kind of covered a few different just baseline things. Let's talk about specifically some key communication concepts and practices. We're going to talk about empathy and validation. We'll talk about setting a shared agenda, as well as empowerment through education. So if you're going to take anything away from today's visit or this education, is really empathy and validation. And again, I think eye doctors, optometrists are probably better at this already, but this is something that healthcare providers in general, a lot of doctors don't have the time, or maybe because of their training, they've lost this aura of giving empathy and validation. And this is really important for chronic pain cases. And again, I think of dry eye disease as a chronic pain condition, sometimes really mild, sometimes worse than others, but it oftentimes these patients are in chronic pain and irritation throughout the day. For one case example, I had this patient just the other year who's 34-year-old Asian male. This is not a picture of him, but he came in, first visit, irritated, itchy eyes, red for 2 years, and had this blurred vision, photophobia. I think he was like 20/60 that day, but he appeared nervous and frustrated. Like you could just sense that from him right away walking into the exam room. And just looking at him, these are pictures of his eyes. You could see him from across the room. His eyes were dark red. And just looking at this, I bet everybody here is probably looking at that and like, that doesn't look like just dry eye to me. But he'd been told and treated for dry eye for some time now. But just asking his history, he had a history of chronic atopic dermatitis. It wasn't that hard to determine that it was chronic atopic conjunctivitis that he was dealing with. And thankfully for his case, steroids knocked his condition out of the park. It was great for him. But the important thing for his exam was that I validated his condition. I validated his pain. He had been struggling with this. And I told him, this is not just a run-of-the-mill dry eye. This is not just normal dry eye. You have a serious and complicated case. You have a lot going on. So I'm not surprised that he's struggling with these symptoms, that he's struggling with work because of his eyes being so red. And when I just validated and showed that empathy for him, immediately he, as a 34-year-old man, started crying in my chair, because he even told me that I was the first person that just like told him that was going on, that was a complicated case, that he wasn't going crazy, that he was struggling so much. So I think it's really important in building a rapport with your patient just by, again, having that level, that moment of empathy and validating their pain and struggles. And again, it's going to show that you're truly listening. It's going to help them understand that their feelings and that you're seeing things from their point of view. So very powerful. Another great strategy is something called setting a shared agenda. This is actually published in literature. And I bet a lot of us do this already without knowing it. But understand that you have an agenda as a provider and your patient has a different agenda. As a provider, we've been trained to think chief complaint, secondary complaint, and then I got to check the vision, I got to check the IOP, I got to be worried about what their eye, the surface of their eye looks like and any diagnostics that we did. And then I'm going to prescribe a treatment, and then I got to get to the next patient. That's like your agenda in your head. But the patient's agenda is that, hey, they may be having dry eye for sure, but maybe they're more concerned about their vision fluctuating and the fact that they can't focus on their computer at work and it's affecting their work life. That may be their focus. That may be their agenda. And so really having a shared agenda is just deciding together what the important issues are. And this is going to convey interest in the patient's priorities. And in research, it shows it takes less than 2 minutes to do. So something that I've been doing myself for this is I tested it out. I started telling patients, even recurrent patients I've had at their follow-up, I'm like, hey, I just want to try something a little different today. I'm going to pull out this little piece of notepad or notepad, and I'll usually just have the routing slip, but I'll just be like, hey, today I want to, before we get started, I just want to know, like, what's the most important things that you want to get out of today's visit? Do you have questions about your medications or treatments or anything? And sometimes they'll just be like, I just want to know why my eyes get so bad in the evening. Like in the morning, they're fine, but in the evening, they're terrible. Like that's one of their big priorities. They want to know that. And being able to ask these questions, and I'll be able to give these, you don't have to read all these are just examples, but just having that moment of being able to write down 2-3 things that really the patient wants to know that you can help them. And that's going to do a few different things for them. Namely, it's going to help you as a provider understand really what the patient wants, not just their chief complaint, second complaint, but really what they're trying to get out of that visit. But it's also going to get the patient to better understand, give them that moment, that opportunity to voice and understand what they truly want as well. Because if you've ever given out a survey after the end of your examination, one of the questions are usually, did the doctor give you an opportunity to ask questions? Did the doctor answer all of your questions? So this is really part of actively reverse engineering the success and 5-star review you want from your patient. You give that, basically asking them, tell me what you need to do, what I need to do to get that 5-star. And that's kind of what you're doing. At a very basic, this kind of the concepts of having a shared agenda is reviewing, asking them, hey, do you know the different types or causes of things like dry eye? What type of treatments have you used? How have they worked? Findings from your exam and what that tells you, treatment options and recommendations, and then just ultimately having a treatment plan. I can't tell you how many times patients have come in to see me and then they are just so happy that I have a plan for treatment. I tell them, hey, this is your condition. These are the best treatments that are going to bring you success. Let's start here because I think that's going to bring you the result the fastest. And just having a plan is right there already puts patients' levels of respect and trust in you. So I really want to emphasize, I think it's important to have a plan for your patients and voice that plan. Now, I want to take a second to kind of switch over to findings in your exam and what that tells you. Because being able to explain to a patient, not just, like we did take when we take our board exams, national board exams, we have that script, right? The very robotic script where you're like, now I am looking at the eye and I'm going to tell you're doing those procedures. But it's not just good to tell the patient what you're doing, but to tell them why you're doing it and what that test tells you as a provider about the condition of their eye, of that specific disease, and being able to say how that influences your decision-making. Because it's going to give that test value that you're charging the patient for, or you're charging their insurance for. but then it's going to enhance your credibility and your assessment and the patient's trust and respect of who you are and the value of them coming in to see you. So first, for an example, I love mybography. Let me know if you guys have a mybographer of any kind. I think this was a game changer in being able to educate patients and help them better understand what's going on. I think one of the downsides to the eye for us is the eye is very complex. And it's also something that we studied. We have this almost curse of knowledge that we understand it, but most people coming off the street don't understand anything about the eyes. And so even just breaking down these photos and showing a patient, hey, we have these glands in our eyelids called meibomian glands. And every time you blink, a little bit of oil comes out of these oil glands and sits on your tear film and coats it, prevents it from just evaporating into the air. You can then go like, hey, right here, and I usually in the clinic have one of the standard photographs that looks like a perfect, very healthy, like 12-year-old's meibomian glands. And then it progressively gets worse. I show them, you can see right here, there's a whole gap of glands that are missing, and some of them that are really small, and you can even see some of them that are inflamed. And I'll ask them, can you tell me which one? You can probably choose for yourself. Where do you sit? Right? And they'd kind of be sitting in between the intermediate and more advanced stages. And so right there, they start to understand, and I can convey, this is why your tear film is evaporating within 4 seconds. And minimum for us in eye care is 10. We need to get your tear film to not break up and evaporate for at least 10 seconds. So we got 6 seconds to go. And then I can better explain that relates to why their vision is fluctuating when they're sitting at the computer. This is why your eyes are getting red and irritated when you are at your son's baseball game. Being able to better explain these conditions and then further link those to what it tells you, and then ultimately how it's going to benefit the patient when you start treatment or make a recommendation. And so again, talking about the testing measures, ultimately the outcome from those tests, what it tells you as a provider, and then leading into the treatment options. And this is really big and important. And again, it's talking, not just, hey, we're treating your dry eye. It's not just we're treating your meibomian gland dysfunction. This is kind of the extra credit. If you can learn a way to talk to your patients where the value is how you're affecting their life and their interest. So it's not just I'm treating your dry eye, making your dry eye better, because really no patients want their dry eye to be better. They want their symptoms of fluctuating vision to go away. They want their red eyes to go away. They want to be able to go out with friends and not have to put in eye drops 30 times a day. So it's finding a way to, again, change the conversation that you're not just treating their dry eye. You are giving them their lives back. You are solving their pain point in their life. If you can start doing that, you're going to start having a lot better adoption of medications and therapies. You're also going to have better adherence to those different medications and therapies. You're going to have a better relationship and understanding with your patient. So that's really a huge one. And then if you're just taking photos, if you don't have something too complicated in your clinic for doing like a mybography, if you just have a slit lamp photograph, you can at least use these and explain to the patient that you're going to be using these photos to monitor the progression or regression of this condition, so that when they have their follow-up, whether they see you or another provider in your clinic, you'll be able to track that and track that success. And those pictures mean so much to patients for understanding their condition. How about treatments? How do you explain treatments? With dry eye, we have tons of treatments, and we don't have time to go over all of these. Blepharitis. Blepharitis has a few. We have had history. We have antibiotics, and certainly anti-inflammatories could be on there too as a combo. Now we have antiparasitics with lotilaner. There's lid scrubs. You maybe have microblep or exfoliation procedures, and even IPL. So how do we better explain treatments? Again, we don't have too much time to go over everything. Number one thing, you don't have to explain every single treatment option. Thankfully, we don't have to do that. But I like to break it down pretty simple into procedures, medications, and then like lifestyle changes, which include like eye drops and warm compresses and maybe omega-3s, different sort of things like that. But I like to explain it like golf. I'm not a huge golfer, but I think of it like procedures. They're my driver. They're going to get me from the tee closer to the goal further faster. Medications, those are my irons. We have to use them a few more times and they're going to be good. They're going to get us closer to the hole, but they're not going to be perfect. And we may have to use it several times. Lifestyle changes, I think of like my putter. Sure enough, you can get from the tee to the goal with the lifestyle changes with your putter, but you're going to have a lot more strokes getting there. It's going to be a lot more challenging than if we just take out that driver, that procedure, hit it once, get you to the green, and then from the green, then that putter can come into play. So that's just an analogy I like to think about. Again, you don't have to explain every option, but offering the best treatments to your patients, starting off with what gets the fastest results, what has the most long-term benefits, and certainly risks. What has the lowest risks, but is the fastest and long-term benefit? I like to explain it that way. Lifestyle treatments are tough. I personally love lifestyle treatments, but the challenge with discussing them is they're very time consuming. There's a lot of them, especially if you're talking about like dietary changes, and it's hard to convince patients to really make those changes in their life. But if you're going to do that route, I would say focus on one. Just focus on one thing at a time because it's a lot easier for someone to adopt one change than to try to adopt like 12. So focusing on something like omega-3s or maybe sleep as a big one. And then furthermore, if you want to deliver that information, which I think is great, have a handout prepared, perhaps make a video and have that integrated into your patient portal or something that you can guide your patients to. I think those are all just a great things about lifestyles. Here's some key phrases and some examples. And I've got 2 pages of these. The number one, I'm not going to read through all of them, but I'm happy to share my slides with you if you would like these just to have and kind of run through. I think these are really helpful if you're a young doctor or maybe you're somebody who is not an extrovert. If you're a heavy introvert, you're just not sure how to talk to people sometimes. Maybe using a few of these, just practicing it, see if it works for you, if it feels natural and authentic to you, then fantastic. The number one at the top of this list, I actually got from Dr. Paul Karpecki. He, just starting off, this concerns me. I'm seeing this change on your eyelid and this concerns me. I'm seeing some changes on your cornea. This concerns me. That will initiate at least a patient to listen up. Oh, that's not good. This is something I need to pay attention to. It'll help them lean in a little bit more to what you have to say. Saying that this is something we need to address immediately. Ignoring this could lead to serious complications. If we don't take action now, this could become a more serious, bigger problem down the line. This is a red flag we should not ignore. These are all just different phrases that have worked for me and something kind of similar to it that I think some people could try to adopt. These other key phrases are, I've highlighted some key words: the best, simple, easiest, fastest. These are all really power words that are often used in marketing and advertising, but are important because it's often what we listen to and value, especially when it comes to not only purchasing a product, but maybe investing in a procedure or investing in a therapy. So I love the word need, right? This patient doesn't just, this isn't just going to work for them. No, they need this medication. They need this procedure. When would you like to schedule? Like, let's say I have a patient who I know that they need IPL because they have ocular rosacea and severe dry eye, a history of chalazions, all these different things. Then I'll not just tell them that they need this procedure, but instead of saying, would you like to schedule this? I say, no, when would you like to schedule this? When would you like to schedule that? And so it puts the patient already in a position to say yes and to think about, okay, well, next week would work. So they've already sort of bought into it. And again, we know that may be the best option for them, whether it be a procedure or maybe a therapeutic, but it's really encouraging them to consider how important that is for their health. And then just breaking things down, easiest and fastest. Well, the easiest way to treat this is with XYZ, or the fastest way we're going to get results is with this sort of treatment. So using those words a little bit more is going to be great. So let's talk about just some other tips and tools in the last few minutes here. First, we're going to touch on reflecting. We're going to touch on the importance of using simple language, using analogies and storytelling, as well as some just amazing benefits of using photography and video if you haven't started using that yet. So this is an old school method of just communication skills, and that's reflecting. And so this is really important when you're doing intake for getting your history. And I love case history. And I think, I think everybody here knows that if you were really good at taking a case history, you can make the diagnosis like 80-90% of the time. I don't remember the statistics. I've heard that. I don't know where that's from, but I believe in it. There's a lot of times just by getting good history, you can make those diagnoses. Mirroring and paraphrasing are great skills to have, especially in my experience dealing with men. Men who don't like to have too much a conversation, but they will, just be like, everything feels fine. And I'll be like, it feels fine. And that pause will give them the moment where I'm just reflecting, I'm mirroring what they're saying. It gives them that moment to then kind of expand on that. They're like, yeah, I mean, most days it feels fine. At the evening things start to, not to feel too great. So suddenly I opened up and gave them more opportunity. So it's not just, oh, you don't have a problem. It actually, there is a problem. You're just not willing to share it. So using reflecting by mirroring or paraphrasing something can really open people up. But the important thing is just not be judgmental about it. And just be really open-minded, having a curious mind to have a conversation. Simple language. This is, there's a concept of talking like a fifth grader. We, again, have the curse of knowledge in our profession that we went to school and we understand what's going on. But if we use high-end medical jargon, like the simple one, hypertension, a lot of people don't know what that means. And so it's better to try to use words like high blood pressure. Otherwise, you're going to come off as not only confusing, but even worse, condescending. If you come off condescending to your patient, they're not going to like you as much. They may still think you're a great doctor, but they're not going to enjoy having conversations with you. They're going to kind of think you're mean. Patients don't like to feel stupid. Nobody likes to feel stupid. And so if you can kind of bring your language down to your patient's level, then you're going to have a better rapport with that patient. A simple language thing that I like to use, if you look at this, I think a fifth grader would probably say, this is a scratch. This is a scrape. If you go even younger than that to being like a 5-year-old, maybe let's say it's a boo-boo. But to us as a professional, would you say that's superficial dermatopathy? No, it wouldn't make sense. So in dry eye, if you're seeing damage to the ocular surface, would you tell the patient, I see corneal SBK? I see exposure keratitis. I personally avoid even using the terms dry eye because how many of our patients don't have symptoms of dryness? They have symptoms of tearing and wetness. That loses people. So I personally like to tell patients, I see damage on the surface of your eye. I see damage to the surface that is causing your vision to fluctuate. It's causing your eyes to appear red, and why it's causing your eyes to feel gritty and irritated. And this damage is likely occurring and building up over the course of the day. I know other doctors who like the word inflammation, which I think also works great. So just telling patients, I see inflammation on the surface of your eye, and so we need to take care of this. And then you can start prescribing and relating that to their symptoms. An analogy and storytelling, these take a little bit more time, but I love working on analogies in eye care. The old school one is, the basketball and the football for astigmatism. Not my favorite. I like to tell people instead, imagine a perfect round basketball, but then a 5-year-old sat on that basketball and it squished a little bit. I think that image works better for me personally. But one other analogy I'll use for acute versus chronic inflammation, because when you tell someone, hey, there's inflammation, there's acute inflammation, which is helpful, right? It's healing to the body. So if you kick a coffee table with your shin, that hurts. If you kick it once, you'll have a red bump, it swells up, but that inflammation is good. It's acute inflammation that's trying to heal the wound. But if you kick that coffee table 30 times a day in the same spot on your shin, that's going to become chronic inflammation. It's not going to be a healthy leg. It's not going to heal correctly. And that's what I think about when it comes to dry eye, when you have a little bit of dryness throughout the day staring at the computer and it builds up throughout the day. It's kind of like kicking your shin in the coffee table 30 times. It gets worse and worse throughout the day. So that's just using an analogy. Finally, photography, pictures with 1,000 words. Again, patients don't fully understand the eyeball, and it can scare some people. It can fascinate some people, but I believe taking photos and showing our patients what's going on not only helps them understand their own condition and take it seriously, but also helps them better value what we do and our education and our specialty. And so I think taking photos all the time is valuable. I know when I go see my dentists, uh, they don't just take pictures if there's something wrong. They take pictures of all of my teeth in every different angle before, and then again after any sort of procedure, even just doing a cleanup routine visit, they take pictures of everything and they show me, hey, this is what it looked like before, this is what it looked like after, and then they explain, why I need this other procedure or something. And I think that's something that our profession can strongly benefit from. So if I see any sort of abnormality on a patient's eyelid, if it's a papilloma or something, and we know what that is, maybe it's not a concern for that patient, but I think it's important that we track things over time and that we further educate our patients. And then, of course, if a picture's worth 1,000 words, a video is going to be worth 1,000,000. So I'll tell you just from a social media standpoint as well, if you can take videos of your patient expressing any sort of oil glands or anything going on, those will be hit fire things on social media. It's like Dr. Pimple Popper. And I personally love expressing my Boomian glands. I know it's not everybody's thing, but it is kind of fun and entertaining.